Hello, everybody. My name is Ali Ahmad, and this is my HAP671 Final Project presentation presented for my Health Informatics program at George Mason University. The start of this presentation, I would like to talk about the importance of screening for diabetes, such as the fact that 1 in 5 adults who have diabetes don't even know that they have diabetes, as well as the fact that diabetes is the leading cause of kidney failure in new cases of blindness among adults in the United States. And that screening asymptomatic adults for prediabetes and type 2 diabetes may allow for earlier detection, diagnosis, and treatment with the ultimate goal of improving health outcomes. So here we take a look at the source of the data where we took distinct ID from our final database and identified that as patients, as well as selecting just a total select count and identified that as total records from our final database. And then we define diabetes. So diabetes itself can be defined as a chronic metabolic disease, as we all know, characterized by elevated blood glucose or blood sugar levels. But we use these CCS codes and converted them into the ICD-9 codes associated with diabetes and use that for our data set. So here we can take a look at which code I used to identify the ICD-9 codes with the most predictors. So here you can see that we selected this ICD-9 and distinct ID and identified as the distinct ID as predictors. So the ICD-9s associated with the most predictors include unspecified essential hypertension, unspecified hyperlipidemia, chronic airway obstruction, esophageal reflux, and acute kidney failure. And here we take a look, it's the same code, but we take a look at predictors and we order them the other from least to most. And we had set a limit for the minimum being 29 predictors associated. So here we can take a look at some of those, which include acute venous embolism and thrombosis of axillary veins, diabetes with peripheral circulatory disorders, or even long QT syndrome. Here we take a look at less obvious but still valuable predictors, such as, and the way we go about that is we take a look at the likelihood of ratios associated with the specific ICD-9 and order them by the ones that have the highest likelihood ratio. So we take a look at the results here, and a lot of them are diabetes related, such as diabetes with renal manifestations, ketoacidosis, juvenile type, or even impaired glucose tolerance. The next slide here we're going to take a look at is the data mining naive Bayes method, which we are able to identify the total risk of developing diabetes. And the way we're able to do that is we take a look at the sum of the likelihood ratio for all the diagnosis, and we're able to use that to calculate the risk of individual developing diabetes. Here we're able to take a look at a specific case, which is one patient with 5 separate diagnoses. And we look at the likelihood ratio associated with each specific diagnosis. We're able to combine them together to take a look at the likelihood of them developing diabetes. So we take one patient that had the 5 specific different ICDs, like I said, and then you take the likelihood ratio that's associated with each ICD-9. You subtract 1 minus the likelihood ratio, add them, and then multiply each one together, and that's how you're able to get the result here. This next slide, we take a look at the cross-validation data method. So we're able to create a training data set and a validation data set. The training data set is where we set 80% of our data and we use 20% for our validation. Both sets of this data are used to check against each other. We check our likelihood ratio as well as our ID accuracy, as well as identify the accuracy of our calculations using both these data sets. And then we're able to take a look at our ROC curve, which shows the relationship between sensitivity and 1 minus the specificity here. And sensitivity being correctly identifying the patient having a diagnosis, as well as specificity correctly identifying the patient not having a diagnosis. In summary, this is a predictive modeling method that is used to help screening for diabetes as well as other diagnoses. This is useful in that it can allow early identification of people who are at an increased risk, and also identifying which complications might occur, and therefore we're able to potentially reduce them, ultimately leading to an improved health outcomes for community as a whole. I would like to take this moment to thank you all for listening to my presentation and hope that you were able to benefit from it. Thank you.